So oftentimes people will notice that they're having emotional feelings of anxiety, but they might not be completely sure if this is really anxiety or something else. A lot of people will tell me that I'm not sure if I'm anxious or if I just don't like doing something, and it can be a hard thing to figure out. But somebody might start having a lot of physiological responses, noticing really uncomfortable feelings in their body, increased heart rate, stomach aches, nausea, shakiness, sweating, being really hot, being really cold, things that they just are trying to get rid of. That might be an indicator that there's some anxiety going on. They might notice that they're in the future a lot, worrying about things that they fear might happen, the what ifs of life, the uncertainty of life. Most people with anxiety tend to have one foot into the future, worrying about things. And they might also notice that they've stopped doing things. They've stopped going to the grocery store. They've stopped hanging out with their friends. They've started to isolate themselves. They've started to get irritable and push people away from them. These are all things that could be indicators of anxiety, and it would be helpful to check it out. Talk to a professional and find out if this is maybe what is going on, because if it is, it's highly treatable, and you could stop a cycle that will get reinforced for years and years to come. People will often come in and talk about how they want to get rid of their anxiety as their primary treatment goal, and it's understandable because it's a really awful way to feel, and I like to reframe that for people in understanding that the goal isn't necessarily to get rid of their anxiety, but to learn how to feel their anxiety and not necessarily respond to it in the way that they have been responding to it before, which reinforces it. Our anxiety comes from the way we think. Not all our thoughts are accurate or helpful, and so we take those thoughts and we try to think about the accuracy of the thought and make decisions based on that. And then the bonus side effect of all of this is after you get really good at feeling anxiety and doing things anyways, the anxiety will go down. But it doesn't go down until you really get good at feeling it and living your life anyways.